Distinguished guests, ladies and gentlemen, good morning. It's a pleasure to be here amid so many motivated minds to speak under the theme Caribbean Health and Tourism, Pathways to Recovery and Resilience. During the past half-century, there has been an appreciation and an understanding of the role education plays in contributing to human capital. That is the economic value of a worker's skills and experiences. Over the years, our region has accordingly made significant investments in education for its citizens. The Bahamas, as an example, spends roughly $100 million on education annually. More recently, however, countries in the region have turned their attention to another key feature of human capital: health. In 2001, the Nassau Declaration from the CARICOM heads of government agreed that central to the wealth of the region is the health of its citizens. This was quite the revelation, as up to this point, health had been viewed more as an expense rather than an investment. Indeed, a report from the Caribbean Commission on Health and Development underscored that the Nassau Declaration was the first time in recent memory that Caribbean leaders had singled out health as critical to the region's advancement and development. The document was clear and unequivocal. Health is a crucial input for the human capital of the region. Health expenditure thus came to be viewed as an instrument for development in its broadest sense, and not merely a consequence thereof. This commitment to buttressing regional health was later reiterated at the heads of government meeting in Montego Bay in 2003, where leaders once again affirmed that the health of the region is the wealth of the region. Health, according to the Universal Declaration of Human Rights, is an inalienable human right, one which allows individuals to reach their full potential and make positive contributions to society. Ensuring healthy lives and promoting well-being at all ages is also a UN Sustainable Development Goal, with universal health coverage being one of the key sub-targets. Winston Churchill went as far as to assert that healthy citizens are the greatest asset any country can have. Though I can't agree with everything the former British Prime Minister said, I certainly can agree with this. A healthy citizenry forms the foundation of any robust society, and many studies support the view that health can serve as a predictor of a country's development. Nations with healthy populations are, understandably so, more likely to experience sustained economic growth. What is more, the reverse, that increase in wealth correspond to gains in health, also holds true. It is ultimately not surprising that high levels of population health tend to go hand in hand with economic prosperity. Higher incomes promote better health through improved nutrition, enhanced access to safe water and sanitation, and increased access to health care. Meanwhile, healthy workers contribute greater wealth generation through enhanced productivity, increased investor confidence, and greater wealth accumulation over a longer prospective lifespan. Healthy children are also more likely to excel cognitively, thus contributing to a skilled workforce. Investing in the health of a nation, ladies and gentlemen, is thus not only prudent, but advantageous given the two-way relationship between personal and physical well-being. Now, whether this two-way causality between health and wealth applies in all cases, I will leave the experts in the room to decide. Regardless of its relationship with income, however, good health can be thought of as a goal in its own right. And given the rise of non-communicable diseases in our region, it is certainly an urgent one. The 2019 STEP survey, conducted by the Ministry of Health and Wellness in conjunction with Pan American Health Organization, shed light on the concerning prevalence of non-communicable diseases in the Bahamas. Globally, NCDs are a major health problem, contributing to over 70% of all deaths and threatening to overwhelm health systems. Given the high socioeconomic costs associated with NCDs, surveillance of associated risk factors is essential for guiding policy, priorities, and programs aimed at reducing their incidence. The World Health Organization stepwise approach to NCD risk factor surveillance, otherwise known as STEPS, is a simple, standardized method for collecting, analyzing, and disseminating data on key NCD risk factors. The first STEPS survey was conducted in the Bahamas between 2011 and 2012, and the 2019 iteration has just recently been released following unanticipated delays. Surveys like STEPS are fundamental for mitigating the advance of NCDs and in turn ensuring the sustainable development of our region. The STEPS survey assessed the main NCD risk factors through 3 steps. Step 1 being socio-demographic and behavioral risk factors, Step 2 being physical measurements, and Step 3 biochemical measurements. These steps consisted of mandatory core components which were expanded and adapted to suit the Bahamian context. The 2019 STEPS report highlighted the critical crossroad at which we find ourselves. As early as the mid-2000s, non-communicable diseases were flagged as a public health threat, attracting regional attention in 2009 with the Port of Spain Declaration on NCDs, and later international attention with the UN resolution on NCDs. From cardiovascular disease to diabetes, cancer, and mental health issues, NCDs are a pressing concern for not just the Bahamas, but the entire world. The NCD epidemic, as it is now being called, is principally fueled by lifestyle choices, namely physical inactivity, unhealthy diet, tobacco use, and alcohol abuse. The STEPS report outlined that of all these lifestyle choices, the Bahamas are showing strides in being sufficiently physically active, with roughly 70% of respondents meeting the sufficiently active criteria. The 2019 findings also reveal, however, that the Bahamas now exceeds the regional average of overweight and obesity prevalence, as well as hypertension prevalence. Tobacco use is also on the rise, while the Bahamian diet, a fiber-deficient diet consisting of excess sugar and salt, is pushing the population toward an unhealthier state. I enjoy a Thai snack from our local bamboo shack or Kentucky Fried Bucket as much as any Bahamian, but we must be careful to consume fried foods in moderation. At present, more than 50% of Bahamians eat fried food up to 3 times a week, undoubtedly contributing to the NCD crisis we currently find ourselves. We have to put the sugary drinks aside, my friends, and opt for water instead. We have to cut down on the spoonfuls of sugar in our tea and coffee, and we need to incorporate more fruits and vegetables in our diet. These individual efforts will go a long way, but they won't be sufficient. The government has an important role to play in ensuring the health of its citizens, and we surely recognize that. We are making historic investments in agriculture and food security as we recognize the benefits of pursuing a path towards self-sufficiency. In the Bahamas, we import over 90% of our food supply. This statistics is not only worrying from a food security standpoint, but also a food quality one. Imported foods, the STEPS report highlights, are not currently subject to routine standard controls for quality, acceptability, or nutritional value. A recent independent study in Jamaica tested for industrially produced trans fat and saturated fats in foods. The results of 300 samples tested showed 40% had trans fats, and half of those same samples were labeled by the manufacturer as trans fat-free. So you see, my friends, our import dependency is compromising not only our economic well-being, but our physical well-being as well. Perhaps less immediately apparent is the influence of health on the vitality of the tourism sector. It is no secret that tourism is one of the most important economic activities in the Caribbean, contributing a third to a half of GDP in most of our nations. Safeguarding this industry, in addition to ensuring that it not only serves our guests but citizens, is thus high on many of our agendas. The health status of a nation primarily influences tourism through its impact on productivity and attendant effects on image and perception. Additionally, the quality of health services in country serves as a decisive factor in destination selection, especially for the older tourists. Even more important than shoring up healthcare services for tourists is ensuring that high arrival numbers do not pose health, safety, and security risks to local populations. We have seen that illnesses introduced by visitors have come at significant cost to the reputation and economic stability of Caribbean nations. SARS, H1N1, chikungunya, Zika, the norovirus, measles, and most recently, the novel coronavirus have all been introduced to this region by travelers and produced undesirable outcomes. From 2010 to 2016, the Caribbean Public Health Agency recorded over 250 outbreaks of gastroenteritis, a third of which were travel-related. One particular outbreak in 2012 caused over 1,200 illnesses, the closure of hotels, travel advisories, and a 30% decline in arrivals to the country in question. Given that the Caribbean is the most tourism-dependent region in the world, the health of our economies is intimately tied to the infectious health of our economically active populations, over two-thirds of which, in the case of the Bahamas, are employed in the tourism industry. As it stands, current health monitoring surveillance systems primarily target local populations, and according to CARPHA, there is no ongoing visitor surveillance and response system. There's also inadequate food and environmental sanitation training for the tourism sector, a dearth of health, safety, and environment standards, and a marked lack of integration between tourism and health stakeholders to address health in tourism in the Caribbean region. These gaps have given rise to disease outbreaks, as well as food safety and environmental sanitation issues across the region. And without sufficient information management systems, standards, and training, these threats can devolve into a severe tourism crisis. Collectively, these threats to the region's #1 industry underscore the need for a system to monitor both traveler and resident health, provide rapid dissemination of real-time information, and offer swift solutions to sudden outbreaks. COVID-19 was perhaps the most striking case, highlighting the importance of such mechanisms, stressing the need for adequate disease detection, prevention, and control as part of public health obligations. It is my understanding CARPHA has made strides in establishing such systems through its 2014 Regional Tourism and Health Program, and I so applaud the team behind those efforts. As we ready ourselves to take in the valuable work of the health researchers, academics, and industry professionals in attendance at this 67th Annual Health Research Conference, the longest of its kind in Latin America and the Caribbean, I would like to highlight a unique challenge the Bahamas faces in meeting the health needs of its people. As an archipelagic country, the Bahamas has to spread its health infrastructure across a wide network of islands and service-scattered population centers. Our very geography thus poses a threat to health equity. With so many islands to service and only so many clinics to suffice. Despite this challenge, however, the reality is we are doing our utmost to give our people the health care they deserve. We have already set in motion upgrades to a number of health clinics throughout our family of islands, all 91 of them. We are also finalizing plans to construct 2 new hospitals, with a groundbreaking in Grand Bahama slated for next month. We've also amended the National Health Insurance Act to provide for catastrophic health care, and we have amended the Mental Health Act to modernize the manner in which this country supports the management of mental health. More recently, we launched a wellness unit to coordinate and implement intentional community-level programming toward encouraging more active lifestyles, providing education on mental health strategies, and offering wellness activities throughout our islands. To specifically address gaps in the Bahamian diet, we have begun exploring alternative tax structures for fruits and vegetables versus sugary and processed foods. And we are working to better support the Bahamas Agricultural and Industrial Corporation and the Bahamas Agricultural and Marine Science Institute. These two agencies will be key in ensuring greater access to healthy seasonal produce and encouraging community farming, where food deserts are especially austere. All this we are doing, and certainly they will say more can be done. But when it really is life or death on the line, I would like to be able to say we gave it our all. And with that, may you all enjoy an exciting and productive conference, and may God continue to bless our nations with good health. Thank you.